When the federal government shuts down, community health centers feel the impact immediately. These clinics serve more than 30 million Americans, including low income families, rural communities, and people who rely on sliding scale or no cost care. The problem is simple: their funding is tied to annual congressional appropriations. When Congress fails to pass a budget or even a temporary extension, the money stops flowing, but the patients don't stop coming. During a lapse, health centers are forced to operate without the federal grants that keep their doors open. Many begin cutting hours, pausing outreach programs, delaying equipment purchases, or freezing hiring. Some clinics report dipping into emergency reserves just to maintain basic services. The stakes are especially high for primary care, prenatal care, behavioral health, and chronic disease management, where even short disruptions can create long term harm. Leaders warn that shutdowns don't just inconvenience clinics, they destabilize the entire safety net system. The end of the article makes one point very clear: health centers are structurally vulnerable to political gridlock. When Congress stalls, the communities with the fewest resources absorb the shock first. For millions of patients, stable governance isn't abstract. It is the difference between having access to care or losing it overnight.